Hey class, and today we're going to be doing a crash course on public health and relevant diseases that are studied in public health. So what exactly is like a project that can go under public health? Well, diabetes. As someone who has diabetes, I can tell you a lot about diabetes. Good morning, class. So today we're going to delve into a topic that affects millions of people worldwide. We're going to explore the impact of diabetes on public health with a particular focus on the minority populations and how it disproportionately affects people. Are you ready? Let's get started. And let's define diabetes. Diabetes is a chronic condition that affects the body's ability to regulate blood sugar levels. There are three main types of diabetes: 1, 2, and gestational diabetes. So I have type 2 diabetes, and it's something that you're not born with it, like type 1. So did you know that certain racial and ethnic groups, such as African Americans, Hispanic and Latino Americans, and Native Americans, have a higher prevalence of diabetes compared to the general population? Why? Systemic racism. The discrepancies are crazy. But that's for another lesson. Well, it's important to understand the impact on these communities from a public health perspective. What contributes to higher prevalence of diabetes among minority populations? Well, there are various factors at play. Socioeconomic disparities, limited access to healthcare, cultural barriers, and genetic predispositions are some of the factors that contribute to these disparities. So the health consequences of diabetes can particularly be challenging for minority populations. They face higher rates of diabetes-related complications, including cardiovascular disease, kidney problems, and vision loss. These disparities highlight the urgent need for targeted interventions. So the economic burden of diabetes on minority populations is significant. Limited access to healthcare and the financial strain of managing diabetes and its complications can exacerbate existing healthcare disparities. Prevention and management strategies need to be tailored to address the specific needs of minority populations. Culturally appropriate interventions, community-based programs, and initiatives that address social detriments of health can play a crucial role in reducing the impact of diabetes within these communities. Public health interventions should prioritize addressing health disparities related to diabetes among minority populations. Collaborative efforts between healthcare providers, community organizations, and policymakers can help implement targeted programs and policies that promote equity in diabetes and prevention and management. We've covered a lot of ground today, exploring the impact of diabetes on public health with the focus on minority populations as it disproportionately affects. Remember, it is crucial to address health disparities and ensure that all healthcare services and resources are accessible to all. Thank you all for your attention and participation. I encourage you to continue learning about diabetes and advocating for public health initiatives that address the needs of minority populations. Together, we can work towards a healthier and equitable future through science.